pleasant good morning and a very warm welcome to the Ministry of Health's update on the national COVID-19 response for Wednesday, 15th September 2021. Our panelists for this morning's update are the Honorable Terence Dayal Singh, Minister of Health, Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, and Mr. Roshan Siram Singh, Geographic Information Systems Manager, Epidemiology Division of the Ministry. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health and moderator for this morning's update. Dr. Avery Hines will begin with the latest clinical, vaccination, and epidemiological updates.
Thank you, Mr. Alexander. Good morning, Honorable Minister. Good morning to my colleague, Mr. Siram Singh. If we can go to the first slide, I'll go straight into the clinical update. That update presents data as at September 14th, 2021 at 4 p.m. At that date and time, we had conducted at both public and private facilities 326,332 COVID tests, of which 47,363 have returned positive to date. Of those, we currently have 42,208 recovered patients and 3,769 total active positive cases and 1,386 deaths, and we extend our condolences to the members of those bereaved families. The total active positive cases are broken down as follows. Individuals in home self-isolation, 3,275. Individuals in hospital, 272. Persons in step-down facilities, 67. And we have 155 new positive cases in the runs that would have been conducted over the last 24 hours, and those would relate to samples collected in the period of September 10th to 13th. There are currently 127 individuals in state quarantine facilities. With respect to vaccination, the vaccination figures are as follows. Individuals who have completed at least one dose of a two-dose regime, 548,713. And those with completed vaccination regimens, those who have completed a second dose of a two-dose regimen, 438,424. Those who received a single dose regimen, 10,378, bringing the total number of persons with a completed vaccine regimen to 448,802. If we go straight into the epidemiologic update, we'll continue. Looking at our epidemic curve, what we note with the most recent set of figures, that is the bars or those vertical lines to the right side of the graph, which are dark orange or brown in color, we see that those basically are the same height as the indigo bars, which represented August, and the fuchsia ones actually slightly taller than those which represented July. So what we're seeing is that we are continuing to have similar numbers of daily cases basically throughout that July, August, and now into September period. That's also reflected by that dotted line running through the graph, which represents what we call the rolling 7-day average, and that's been hovering somewhere in the high 100s to low 200s for the last several weeks, last 9 to 10 weeks at this point in time. So we're at a plateau, and we continue to monitor that very carefully. If we go to the next slide, we aggregate that same data now at a weekly level, and it helps for those who understand weeks better than days. What we see with the weekly data is that, again, the heights of those weekly bars have remained fairly similar over the past 10 weeks or so. We've seen fluctuations, sometimes small percentage changes up or down, that represent minor changes in trend from one week to the next, the biggest of those so far being a 26% increase from week 35 to week 36, and that week 36 being the last completed week. So we are seeing ups and downs, a fairly steady number of cases per week, but we did see a relatively large, comparatively large increase, 26% from week 35 to 36. So again, we're monitoring this trend. And at the background of that peach or salmon colored background we're looking at what we call the positivity. That's the percentage of COVID tests that return positive. and we've seen that fluctuate between 25 and 30% over, again, that same 10-week period, with the current positivity to date, as at yesterday, being 25% for this current week. So we continue to monitor that, as that is some indication of the direction in which things may be going, and we see that basically we're continuing a plateau over the last 10-week period. If we go to the next slide, looking at the data again on a monthly basis, we see that we have a clear demonstration that July and August had basically the same number of cases. We're halfway through September, and we're approaching the halfway mark for the August number of cases. We may end September hopefully with a slightly smaller total, but it's not going to be a huge drop because we're seeing similar daily cases from day to day. And again, looking at that positivity, you're seeing that again the positivity has fluctuated between 25 and 30%. The total that we're seeing there for the for the month of September was 2516, and the number above that was just the number above the background positivity was really just the number from the day before. So moving to the next slide, we see that demographic distribution has remained fairly constant throughout. And by demographic distribution, we mean the number of cases or the proportions of cases in the various age, sex strata or groups. And we see that basically we have just about the same proportion of males and females, 50.7% female, 49.3% male, and that more than half of those are in that 25 to 49-year-old age group. Moving to the next slide, we do see that among the fatalities, the numbers are weighted in the higher age categories, above 60 being more than 2/3 or just about 2/3, and males and females now approaching more equal numbers, with about 58% male and 42% female, just about. And the most important thing that we continue to reiterate about the fatalities is that many of those individuals would have had comorbid conditions, and those conditions contribute to a higher risk of death, and therefore they are a good reason to seek vaccination to reduce your risk of having an adverse outcome. So with that, I'm going to turn you over to Mr. Alexander.
Thank you very much, Dr. Hines. Now, wouldn't you like to know which communities and counties have recorded the highest number of COVID-19 cases? Or, to let you know and to speak more about this, I now invite Mr. Roshan Siram Singh to present.
Thank you. Honorable Minister, Dr. Hines, Mr. Alexander, members of the media, and members of the listening and viewing audience, good morning. Today we begin with our first slide as we take a look at our point map representing cases mapped for the period epidemiological weeks 34 and 35, with epidemiological week 34 representing the period 22nd of August to the 28th of August, and epidemiological week 35 representing the period 29th of August to the 4th of September. And we know generally that the pattern which we previously noted holds, with cases favoring those areas which are highly populated and along major road networks where we have settlement taking place. We know that the spread by county is relatively proportional when comparing epidemiological week 35 compared to 34. As we switch to our chart on our next slide, the chart which represents the cases recorded by county, we'll look at that shortly, but in the meantime, we'll take a look at the cases aggregated at the community level. Can you just go back one slide, please? Yeah, at the cases aggregated at the community level. And what we see from this map is that spread continues to take place in various parts of the country. We know that Sangre Grande as a single community has recorded the highest number of cases, with other areas such as Valencia and Barapur and Mova also recording a high number of cases over the period. You may recall that about a year ago, the area of interest, the county of interest, was St. George East. However, now we are seeing communities in counties outside of St. George East are recording the highest number of cases. Can we go to our next slide, please? As we switch to this slide, we take a look at the count of cases mapped per county for the period epidemiological weeks 32 to 35. And we note from this map, while County River-Mayaro continuously recorded the lowest number of cases, and while there are fluctuations among the counties, we know that County Victoria and County Carney consistently recorded the highest number of cases for each of the given weeks, with County Tobago also recording a high number of cases. As we switch to our next map, we take a look at the cases. However, in this case, we look at it as a density map. And what we know generally is that the patterns which we've identified in the past continue to hold. We know that area stretching from the East Port of Spain to Arima along the East-West corridor continues to record a high density of cases, as well as other population centers in cities and towns. Areas such as Sangre Grande, San Fernando, Point Fortin, Diego Martin, and Chaguanas in Trinidad, as well as areas such as Cabro and other western parts of Tobago. These are the areas which have recorded the highest densities of cases for the period epidemiological weeks 34 and 35. We now switch to our space-time trend analysis map. And what this map shows us is areas that have noted increases or decreases, so upward trends or downward trends, over the period epidemiological week 32 to 35, which in terms of days would cover the period the 8th of August to the 4th of September. And what we note is that in many of the areas across the country, there were no identifiable trends, and this could be attributed to the minor fluctuations and the plateauing that Dr. Hines mentioned earlier. However, in about 40 areas or so, we noted there were upward trends. What this particular map allows us to do is to look at data at a level that is more granular than the communities, because the hexagon, which are 1 kilometer hexagon, are more granular than the communities, which tend to be a bit bigger and irregularly shaped. As we take a look at our next slide, we take a look at County Carney in particular, and we see that these areas in which upward and downward trends were identified are scattered across the county, that these areas are not specific to any areas of high population or anything like that, because we are seeing it, and also we are seeing upward and downward trends also in areas which are outside of the population centers within the county. Similarly, we see this in County Victoria in our next slide, with areas of upward and downward trends being scattered across the county in both the populated and higher population areas and the low population areas. And finally, we take a look at Tobago. Again, in most cases, there were no identifiable trends. However, there were a few areas scattered across the island in which trends were identifiable as being either upward trends or downward trends. With that, I will say thank you and hand over to Mr. Alexander.
Thank you very much, Mr. Siram Singh. And I now hand you over to the Honorable Minister, who will update the public on the progress of the national COVID-19 vaccination campaign. Honorable Minister.
Thank you very much, Al. Good morning to Dr. Hines. Good morning to Roshan Siram Singh. Good morning, ladies and gentlemen of the media, and to all viewers and listeners on the different platforms. Very good morning to you. So Dr. Hines would have given you the aggregate data on vaccines, so I'm not going to go there. What I would like to do at this point in time is to do a disaggregation of the data to show us points of concern and specific populations that we are trying to reach to get vaccinated. Because when one looks at the aggregate data and you hear 400,000 and 500,000, you may say, wow, that's a lot of people. But on the opposite side of the coin, we have to look at that part of the population that is unvaccinated. So, could I have my first slide, please, this morning? So, this one in green talks about the COVID-19 vaccination of the total population of 1.4 million. So far, the light green on the left-hand side shows that 32% of the population is fully vaccinated. That means 448,802 people have completed either 2 doses of a 2-dose regime, or more recently with the one shot and done, 1 shot and you are considered fully vaccinated. You are then considered, I believe, fully immunized 2 weeks after. Dr. Hines?
Yeah.
Correct. So 39.2% have at least one shot and 32.1% fully vaccinated. That's the light green. That's the glass half full analysis. Of concern now is the darker green. It means 60.8% are unvaccinated. Now, if we disaggregate that figure and take out the children under 12 who can't be vaccinated, and let's just talk about the adult population for now. The adult population. The adult population in Trinidad and Tobago over 18 is approximately 1 million people. 1 million people. So we have to reach a couple 100,000 people still. 200,000, 300,000, 400,000 people still to get us out of the woods. The people on the left with the light green, as vaccines are doing around the world and as the evidence is showing, even if they contract COVID, they will not have serious disease. They will have mild disease. And they have, in local statistics, when we are now following the international trends, you will have a 99.4% chance of not dying of COVID. That's a good thing. So that only applies to the 39.2% who are fully vaccinated. They are relatively safe from death or from contracting serious disease. The 60.8% who are unvaccinated will most likely have serious disease, will most likely need ICU care, HDU care, and will most likely, if they contract COVID, have a very bad outcome, which is inclusive of increasing mortality figures. Ladies and gentlemen of the public and the media, this is of deep concern to us, as we have been saying all along, the unvaccinated population. So far, the Delta variant, we have been catching it at quarantine sites. One or two who presented with the negative PCR and fully vaccinated and went home, we have been getting them. So far, so good. However, if the Delta variant, as it has in other countries, gets a hold in the community setting amongst a largely unvaccinated population, things could turn bad, literally, Dr. Hines, overnight. Overnight. In hours, not days. The entire health system will become overwhelmed. The economy could be affected. So, I want to make a clarion call this morning for adults to be vaccinated. No appointment is needed, no lining up. It is so easy, and you have your choice of vaccines. We have been given all the information, working with NGOs on the ground to answer your concerns and so on. So this is an area of concern this morning, as it has always been. The large percentage of the population, 60.8% of 1.4 million people, who many of whom are eligible, but still, for whatever reasons, are not being vaccinated. Could we go to the next slide, please? This has to do with the persons aged between 12 to 18. As you know, we started this process of vaccinating persons 12 to 18 about a month ago. I think today is actually a month. With the Pfizer vaccine, the only WHO-approved vaccine approved for children between the ages of 12 to 18. Using Ministry of Education data, they estimate they have roughly 90,000 children in that age cohort. The light purple speaks to 39.4% have at least received one dose. 16.7% have received both doses. So that's the glass half full part. Of concern now is the dark purple. 60%, 60.6% no doses received. So it means of that 12 to 18 cohort, we have roughly about 54,000 children between the ages of 12 to 18 that are not on their way to either a first dose or a second dose. The same concern about the Delta variant catching on in an unvaccinated population between the ages of 12 to 18 is dire. Please pay attention to what is happening in other countries that can't provide care for children or even adults, where whole hospital systems cannot even provide basic care for their heart attack victims, their stroke victims, and so on, because every hospital is now overwhelmed and overrun by COVID-19. So we need parents and guardians, especially those who are unvaccinated parents and guardians, to get vaccinated. And if you have children between the ages of 12 and 18, to please also get them vaccinated. Because if the Delta variant, which so far we have kept out from the community as far as we know, it doesn't mean it is not in the community. It simply means, Dr. Hines, that we have not discovered one as yet. For you to discover one, it has to be there, and has to be there for a little while. So I am making an appeal this morning for both the adult population, get vaccinated, and this age group 12 to 18 to get vaccinated. The last item I want to deal with, you could come off the slides now, thank you. You would have been, for those who are following these press conferences, we have been talking about the impact of non-communicable diseases on the unvaccinated. We have been talking, and Dr. Hines and other professionals like Dr. Hamid, Ms. Michelle Ash, who was here recently, talking about the link between COVID, acquiring COVID, and non-communicable diseases like diabetes, hypertension, and so on. We started running this ad in the newspaper this morning, and we have it on social media now. What we are doing is drilling down to one major non-communicable disease in Trinidad and Tobago, and that is diabetes. The estimate for the number of diabetics in Trinidad, as all the experts will tell you, from Ms. Ash to the president of Diabetes Association, the estimate is between 182,000 to 280,000 persons with diabetes. Let's put back up the ad, because I want to walk through that ad as slowly as possible. This ad is in the one newspaper today. It will be in all three. It is on our social media platforms. It has been shared on social media. The ad simply says, because our research is telling us that people with diabetes still believe that because they have diabetes, they should not be vaccinated. That is what is circulating on social media. So we are focusing today. Do you have diabetes? then the COVID-19 vaccine is for you. And we are giving people 3 major take-homes. 1, persons with diabetes, which we call in Trinidad sugar, or have sugar, are 3 times more likely to have serious complications from COVID-19 than persons without diabetes. That has been scientifically proven. You can go in to websites like PubMed and so on that talks about this increased risk that if you have diabetes or any other NCD, whether it's asthma, what we call pressure, obesity, but in the case of diabetes, because we want to talk to that subpopulation of diabetics. The ad then goes on to say, diabetics are more at risk for hospitalization and death from the COVID-19 virus. And Dr. Hines and everyone else has been saying this for months now, that when they look at the comorbidity profile, diabetes or sugar, high blood pressure, or what we call pressure, those persons very often have a very negative outcome. And the third bullet point, the COVID-19 vaccines are safe and effective. And finally, our strategic message that we have been putting out for the past month or so, don't delay, vaccinate today. Many people are delaying their decision to be vaccinated because they are not seeing a crisis. But what we are trying to do is to prevent a crisis. So if you could come back to me, please. So, in addition to the known population of 182,000 to 280,000, you would have heard Dr. Trotman, maybe about a month or 2 ago, talking about the undiagnosed diabetic. That's another problem because many people don't know their health status. They don't know their numbers. They don't know what their fasting blood sugar is, their HbA1c. They don't know what their blood pressure is. They don't know what their cholesterol levels are. And you would have heard Dr. Trotman say that many of these people who are succumbing to the disease did not know they were diabetics, did not know they were hypertensive. So one of the takeaway messages this morning, if we are to prevent further deaths going forward, is for people to know their health status. Get screened, either in a public facility or by your private doctor. Also, as Ms. Michelle Ash spoke to this on Monday, I believe, lifestyle changes, the sugar, the salt, the soft drinks, the excessive reliance on refined foods, whether it's refined flour, white flour. So one of the things going forward is that we can make some immediate changes to our lifestyle, which will help. Get screened. But this targeted campaign this morning on diabetes is to correct the perception based on our research that people with diabetes feel that because they are diabetic, because they have some underlying condition, that somehow the vaccine is not for them. So we want to correct that perception. And in addition to being screened, in addition to making some lifestyle changes, exercise more and so on, the third thing that we could do this morning is to simply get vaccinated. The science is there, the evidence is there, and the science and the evidence is being shared on the ground at the health centers with your doctors, with your NGOs, with your church leaders who are responsible, and I thank them. So this morning, as I wrap up my little presentation, we are focusing this morning, as we have been for the past couple of months, on non-communicable diseases, but we are zeroing this morning on diabetes. We have been working with the Diabetic Association of Trinidad and Tobago, providing them with vaccines in the past. but we are asking all persons, diabetic or not, all adults, diabetic or not, simply get vaccinated, because if the Delta variant gets a hold in the community, I could only say, heaven help us. Let us learn from the experiences from other countries near and far. Let us not be lulled into a false sense of security by what people are saying. This is not me saying it. People are saying, well, things are not too bad. I could still get a place in the hospital. I can still get this. I can still get that. But that could be taken away from you in a flash, because the Delta variant, Dr. Hines, is how many times more transmissible?
It's 3 to 4 times more transmissible than the Gamma.
It's 3 to 4 times more transmissible than the Gamma. 3 to 4 times more transmissible than the Gamma. We can't depend on luck only to keep the Delta out. We could also depend on the social distancing, on the wearing of masks, on the washing of hands. But now we have this excellent tool, this excellent weapon called a vaccine. And since May, when we started the mass vaccination drive, which peaked but then slowed down, there is no reason, and I hope Dr. Hines could bear me out here, there is really no reason for people to still be dying from COVID by 3s, 5s, 8s, and 9s per day, especially as they are unvaccinated. Let us not get numb to these persons who are dying. These are real people with real families. And at the end of the day, let's get vaccinated to protect lives, to protect livelihoods, and to save the healthcare system of Trinidad and Tobago. Thank you very much, Al.
Thank you very much, Minister. And as you know, the vaccines are free, they are effective, they are accessible, they are available, and you have many choices. Up next is our question and answer segment. We remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please identify the panelists to whom you wish to address each question. And of course, time permitting, we will accommodate a second round of questions. We will take the first question from azpnews.com. Good morning.
Good morning, Private Harry, azpnews.com. My first question is for Dr. Hines. Dr. Hines, you said that we have a plateauing of the cases of the new COVID-19 cases. Has the ministry done an assessment to say where these new cases are coming from? Where is it that is the functions? What are the specific instances that these new cases are coming in? And my second question is for Minister. Minister, good morning. You said that we have about 54,000 of the children between the ages of 12 to 18 who are not vaccinated. What happens in a case where a child wants to get vaccinated, but his parents doesn't want him to get a jab? Is there anything that the ministry can do in a case like that? Thank you very much.
I'll take the second question first. So as it stands right now, we cannot vaccinate children without parental or guardian's permission. But you know what is so sad about this, and I spoke about it at Saturday's press conference, many persons, children between the ages of 12 and 18, who don't buy into the conspiracy theories and who are more evidence-based and do their own research on known scientific sites and don't buy into the conspiracy theories, have been asking their parents, please, I want to be vaccinated. And many parents are not even listening to their children, and that is sad. And as I said, you have what is the number I quoted? 54,000 school-aged children between the 12 and 18 who are just sitting ducks for the Delta variant, sitting ducks. And when we had our vaccination drive with Pantrinbago on Sunday, 2 teachers were there, and they came up to me and said, Minister, our children want to be vaccinated. This was evidence and testimony from 2 teachers who were there. But the children tell them their parents are preventing them from being vaccinated. So the short answer to your question, we cannot vaccinate children. This is not like long ago when I was in school, and I don't know if Avery is old enough to remember. In our days, the nurses used to come into the school, vaccinate you, give you your card, and you go home and tell your parent, I got vaccinated, you know. But times have changed. We are a very litigious society. So those days of vaccinating children in the school setting and then giving them a vaccination card and sending you home. And that is how we control things like mumps, measles, rubella, polio, and all those things, by vaccinating children. Let us do the same thing with COVID. And parents, this morning I am pleading with you. Please allow your children, if you don't want to be vaccinated, that is fine. But give your children a chance of going back to physical school. The Minister of Education gave a brilliant presentation last night at a meeting. Absolutely brilliant. And I want to congratulate her this morning about what physical school brings to the all-round development of a child. A child is losing out too much sitting in front of a screen. You may be educated, yes, but then she spoke about the education deficit. How many children had got above 90%? Nice, as the glass half full part, but how many children scored 30% and below? I urge every parent to replay what Minister Nyan Gatsby Dolly said last night. And physical school is more than learning. It's about building relationships, socialization, playing sports, getting your school feeding program meal. It's about your all-round development, building relationships. So I am really appealing to parents. Bring your children out to be vaccinated. Thank you very much.
Thank you,
Okay,
Dr.
thank you for your question. Now, Mr. Bihari, your question seems to presuppose that there's some special place or special setting in which people are currently contracting COVID-19. What I want to emphasize is that COVID-19, the virus that causes that, the SARS-CoV-2 virus, is in circulation in the population. People can get it from anybody in the population who is infected. It's not specifically at particular functions or in particular settings, but it's just that there is a proportion of the population that is currently infected, and that proportion of the population can pass the virus on to susceptible individuals. So we maybe need to stop focusing so much on which function or which setting and really focus more on how we prevent ourselves from becoming infected and how we prevent ourselves from having adverse outcomes if we do get infected. And those preventive measures are the same measures that we've been emphasizing since the beginning, including the physical distancing, the wearing of the masks, the hand hygiene, the avoiding places of gathering when you are ill, the adherence to all the other public health measures, and of course getting the vaccination, which is one of the strongest layers of risk reduction that's available to everybody at this point in time.
Thank you very much, Dr. Hines. We now go to 103.1 FM for your 2 questions. Good morning.
Hi, good morning to everyone. Rai Ricomas from 103.1 FM. I have 2 questions. They can be answered by anyone on the panel. The first one is, given the international criticism and speculation surrounding a tweeted claim by Nicki Minaj, we're asking directly today, have there been any reports to health officials in TNT of testicular swelling due to the COVID-19 vaccine? That's question 1. And the second question is, there have been numerous claims of persons going for additional COVID-19 doses despite already having their full regime, whether it's extra doses of a particular vaccine or seeking out a different vaccine from the one that they would have gotten previously. Is the ministry aware of such reports, and what additional measures will be put in place to address this? Thank you very much.
Okay, so thank you. I will take both questions. So yes, so claims are being made. One of the reasons we could not respond yesterday in real time to Ms. Minaj is that we had to check and make sure that what she was claiming was either true or false. And unfortunately, we wasted so much time yesterday running down this false claim. It is, as far as we know, at this point in time, there has been no such reported either side effect or adverse event. And what was sad about this is that it wasted our time yesterday trying to track down, because we take all these claims seriously, whether it's on social media or mainstream media. As we stand now, there is absolutely no reported such side effect or adverse event of testicular swelling in Trinidad, or I dare say, Dr. Hines, anywhere else? None that we know of anywhere else in the world. So that's a claim. On the other claim that you are making, again, we are hearing these claims and we check out all these claims. But if you have concrete evidence, a name or so on, pass it on to us quietly and we will investigate it. So thank you for raising those two issues.
Thank you very much, Minister. Power 102, we are ready for your questions. Good morning to Power 102. Okay, so we'll move to IETV. IETV, good morning. You ready for your questions?
Hi, good morning. Dina here from IETV News. I have two questions. My first question would go to Dr. Hines, if possible. Dr. Hines, has the Ministry of Health recorded any deaths related to COVID-19 in persons who were fully vaccinated? And my second question, perhaps also to Dr. Hines, are community cases, persons who tested positive for COVID-19, are they also tested for the Delta variant? I know as it stands that most of the testing is done with persons who are repatriated, but are community cases of COVID-19 also tested for the variant? Thank you.
Okay, thank you for the two questions. I will go backwards and answer the second one first. Yes, there is a proportion of the community cases which is currently being sequenced, tested for which variant is in circulation. It would not be all of the cases because there simply isn't the resource to do that. And the focus is on looking at those individuals who have a higher risk of being exposed to the Delta variant. So a lot of the sequencing is being done in the positives that come out of that repatriation, ongoing travel exercise, because we're fully aware that Delta is the dominant variant in the US, where a lot of our travelers are currently returning from. And we want to make sure that we're aware of what's coming in. But yes, we also do sequence a proportion of the community cases to ensure that we're not missing anything. And bearing in mind that because we don't sequence all, if there are cases that are few and far between, we may not immediately pick that up, which is what the minister is alluding to when he says, we haven't seen any cases. We continue to check as soon as, or if the eventuality arises, that we note cases that have arisen in the community without a travel link, we will make that announcement. But we want to make sure that we keep that from happening for as long as possible. And one of the ways that we keep that from happening beyond the controls at the border is we keep the virus from spreading at all within the population by the vaccination, by the public health measures, by adherence to the masking, by adherence to all of the guidance that we've been continuing to give. So all of these things together are going to help us. But very importantly, raising the levels or the proportion of vaccinated people in the population is going to be a very strong, net, a strong layer of protection that we really need to emphasize. Now, we have been asked a question on fully vaccinated individuals and deaths in the past. We have pointed out that in the very few instances, I think we had 2, and then I believe it became 3 in more recent times, individuals with other severe comorbidities that had a full vaccination regimen applied, but subsequently did get COVID and passed on. But that is 3 out of, at this point, 3 out of the 1,300 that we have, and counting from June come forward, 3 out of that number, because we were actually checking vaccine status for each death. So it is a very, 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 very small percentage, and I'm using the varies as many times as I can because we do have to emphasize that while it can happen, the probability is greatly reduced. And what we've seen is that the deaths, the vast majority of the deaths that have occurred since we began the vaccination, we've been looking at deaths and vaccination status, and the vast majority, more than 99%, are in the unvaccinated or the not yet fully vaccinated individuals. So hopefully that clarifies.
Thank you very much, Dr. Hines. We now invite Guardian Media Limited to pose your two questions.
Hi, morning everyone. Rashad Khan here from Guardian Media. So both my questions will be to Minister. Minister Diyal Singh, I just want to follow up on what Rai was asking, his line of questioning. Considering that we're in this predicament where we're basically begging people to get COVID-19 vaccine, do you think such a tweet coming out from such a prominent person is or will play a role in our issue that we're having right now with increasing hesitancy within the population? And my second question is, with regards to that extra doses, people are receiving extra doses, is there any such penalty or anything for doing something like that?
Okay, so thank you. So let's go back. There are claims. See, you have made a jump from a claim to a fact. The reporter from 103 said there were claims. My response is, if you send us the information, because we receive it, we investigate it, and so far those claims have not borne fruit. So we don't know that is a fact, but if again, Richard, you have information, please send it to us. Is there a penalty? At this point in time, the answer is no. There is no penalty if you take another vaccine. To answer your question about the tweet, put it this way, it didn't help. It certainly did not help us. And we had to expend a lot of time and energy yesterday, because suppose it was true, and that is what happens to us with these social media tweets and Facebook postings. We have to research them, because suppose it was true. We don't want to be accused of just ignoring it. But we spent a lot of time yesterday trying to track it down. So far, it has not proven to be true either in Trinidad, or as Dr. Hines has said, anywhere else in the world, that this is a known side effect or adverse event of vaccination. But her tweet certainly did not help, because people like her are social influencers, and they do carry some sway. So yeah, it certainly didn't help, and will make our job a little harder, which we don't need right now, Richard. So thank you for asking the questions.
Thank you very much, Minister. We now go to Newsday. Newsday, we're ready for your two questions. Or TV6. My apologies, TV6. Good morning.
My question.
Go ahead.
Hi, morning.
Good
Urvashi
morning.
from TV6. Just to find out from Dr. Hines if we can get a count or an idea of the number of nationals versus non-nationals who have been vaccinated, either the single dose and the double dose as well. Thank you. And Minister, as it relates to the reopening of team sports, professional athlete training, student athletes training as well, what are we looking for in terms of numbers for that to happen, and how soon? Thank you.
Thanks, Urvashi. So I'll take the second question first. So whenever we ask about opening predicated on numbers, we always say there is no one number we look at. We look at all the numbers. So we look at hospitalization rates. We look at mortality figures. We look at vaccine numbers now. We look at the charts that Roshan Sriram Singh will present. So there is no one magic number that we look at, but we look at the whole picture. We take all the pieces of the jigsaw, put them together, and see what picture that paints epidemiologically to open up any particular sector safely, what sectors can be opened. So there's no, Urvashi, there's no one magic number we look at. But as I say, each number is part of a jigsaw. Each trend is part of a jigsaw. We put them together and see what picture emerges. If the picture that emerges tells us we could take this extra piece of risk, then we take it. If it tells us we need to hold where we are, we hold. If it tells us, like in May, when the picture told us if we didn't do something, we had 3 to 7 days of hospital bed space left. And that was one of the factors that led to the state of emergency. So it's a whole series of factors you take into account and you look at the picture it paints. So I hope that that brings some clarity to the issue. Thank you very much, Urvashi. Dr.
Okay,
Hines.
thanks for the first question. Now, epidemiologically, we don't track whether the people vaccinated were nationals or non-nationals, because once you're resident in the country, then you're part of the population and your vaccination status poses a risk or a benefit depending on whether you are unvaccinated or vaccinated. So while this info, these stats may be available at the more granular level, those aren't stats that we have at the national level at my disposal. We can verify whether those bits of information are available, and we can put that onto the Ministry of Health website as needed. But the important thing to note is that whether you're a national or non-national, once you're a resident in the population, then everybody who's resident needs to be vaccinated to reduce the risk of transmission and to move towards that level of herd immunity that we continuously attempt to reach.
Thank you, Dr. Hines and Minister. We'll now take questions from the Newsday. Newsday, we are ready for your questions.
Good morning. My questions are for the Minister.
So a little
My
louder,
first question
please.
is, what percentage of Form 46 students need to be vaccinated to allow them to return to physical school? And is there still a plan to use schools to vaccinate students? And my second question is, what has the turnout been in rural communities for vaccinations, especially with the mobile exercise that's been going on? And if the numbers are too low, will you discontinue this program? Thank you.
Thank you. So, as the Honorable Prime Minister and the Minister of Education has said, the policy is that there will be 2 streams available for schooling, the virtual stream and the physical stream. The physical stream are for those who are vaccinated, and the virtual stream are for those who are unvaccinated. There's no magic number, but when the Honorable Prime Minister made this announcement a few weeks ago, I remember it clearly. He said, if you are unvaccinated, you will receive your education via the virtual stream, and this was echoed last night again at the meeting with Minister Nayan Gasvidali. And if you are vaccinated, you will get into your physical classroom setting. What has been the response from the rural communities? In each of the community drives that we do, and I could speak to you now from experience as a member of parliament from St. Joseph and also talking to other persons. Each community drive will give us a yield of about between 50 to 100 or 150. So that's the kind of numbers we tend to get with the rural community drives. And that is how we are building our numbers slowly but surely, and it adds up. So what I can tell you is this. Let me just get my figures here. The most recent average of first doses we are administering is around 3,000, 3,005 a day. When you add the one shot and done component to that, which is the Johnson & Johnson vaccine, that averages about 500 to 700 a day. So 3,000, 3,005 plus 700. So you are doing roughly on a day across both islands, Trinidad and Tobago, about 4,000. You do that for a week, let's say 5 or 6 working days, 20,000 persons. For a month, 80,000 persons. So it's a slow progress now, because most of the people who engage in what we call health-seeking behavior, who will seek out the vaccine, have been vaccinated. That's your 448,000 persons. Who we are trying to reach now are those persons who want convenience. They're willing to be vaccinated, but you have to bring the vaccination to them. That is what we are doing now. They want information. They want one-on-one counseling, and this is what these rural community drives are doing, whether it's at PTSC, whether it's at Sangre Grande, Toco, St. Joseph, wherever. So I have given you some rough numbers as to what the daily take is, but at the community level, you are doing between in each intervention about 50 to 150 doses in each of those community interventions. Thank you very much.
And thank you, Minister. CL Communications, we are ready for your questions. CL Communications.
Hi, good morning.
Good morning.
Natalie Singh, Caribbean Lifestyle Communications. My questions are for Minister. What is the uptake of vaccination by the police service, since we are still seeing police officers dying from the COVID-19? And then secondly, how much is social media a weapon in TNT's response to COVID-19? Thank you.
Thank you. So we have made vaccines available to the Ministry of National Security. So they will take vaccines from us. We have made any amount of vaccines, any brand of vaccine, to them via the Ministry of National Security. The exact uptake, I will have to defer to the Minister of National Security, who might be more okra with what the police service is doing, or we could contact the Commissioner of Police, the head of the Defense Force, and so on for that granular detail. But the Ministry of Health has made every brand of vaccine available to our defense forces, Coast Guard, police, everything. Prisons. We went into the prison system too. We spoke to them on prison radio. We had 3 inmates in studio posing questions that they canvassed from their fellow inmates. So the communication goes on, and we encourage every people under the ambit of Ministry of Education, Pantrin Bago, every chutney side, every chowtal side, everything, just get vaccinated. Okay? Thank you. Oh, and social media, sorry, yes. The role of social media is very important for both good and bad. So we are on the social media platforms. We'll be stepping up later, I believe this week. I think Candice was talking to me about that yesterday. Ramping up our social media profile again. We are on radio very, very often. Radio is proven to be very effective. I myself was on Akashvani this morning. I was on 95.5 drive time yesterday. I was on Power 102 last week. I'm going to more radio stations. And then these things get tweeted. These things get repeated on social media. So we are using every communications channel at our disposal. Thank you very much.
Thank you very much, Minister. We go to Guardian Media Limited for a follow-up question.
Hi, thank you very much. Minister, I don't know if you'd be in a position at this point in time to give us an update as to where you all have reached in any discussions or planning for the implementation of these virtual safe zones that the Prime Minister would have mentioned some time back. Thank you.
Yeah, thank you, Richard. So the issue of the safe zones is being planned, it's being worked out, and I was in conversation with the Honorable Attorney General just up to yesterday, and as soon as he has a product that passes muster with all the internal stakeholders and external stakeholders, we will announce it. Thank you very much.
Thank you, and we quickly go to TV6 for your follow-up question.
Hi, Dr. Hines, just a follow-up. I need something clarified here, right? So we have 548 single doses dispensed of the vaccine, right? And we have 448,000 of the 2 doses. Is it that when you give the 548 48,000 persons the additional dose, we will then have 448 plus 548,000 persons fully vaccinated. Thank you.
Okay, thanks for allowing us to clarify that. We have addressed that in the past. When we give the persons vaccinated with the first dose, that's everyone who has received at least one dose. Included in that are those who have received their second dose, and those who have received their second dose are then outlined as having received either a second dose of a vaccine or having received one dose of a single dose vaccine regimen. So at the end of the day, when we count the number of fully vaccinated people, that of course falls within the number who are partially vaccinated at this time. So the difference between the fully vaccinated and those who received just one dose of a two-dose regimen would be the yet incomplete sets of vaccines. So hopefully that clarifies.
Thank you very much, Dr. Hines. Ladies and gentlemen, that's all the time we have for our question and answer segment. As we close, we want to remind persons to remember the COVID-19 vaccines have proven time and again to be safe, effective, free, and available. No appointments necessary. If you haven't received your COVID-19 vaccine as yet, please get yours now. Do not delay. Vaccinate today. Be safe and goodbye for now.
TTT News, delivering more news more often to more people. Follow us on social media at TTT Live Online. Log on to www.ttt.live.